And can anyone from the media please let us know in the chat if they are not able to record? Okay. All right. Thank you very much for joining us here today. I understand we have important information to share with the public. Today we have the Hawaii Department of Health Director, Dr. Kenneth Fink, and our Superintendent of Education, Keith Hayashi. Today we're going to discuss preliminary results. These are unvalidated data that was just received from the ash sampling, and we are letting you know about some elevated toxic substances. So first up, I would like to have Dr. Fink to share with us what the results mean.
Great. Aloha. And I'd like to just mahalo everybody for joining us on a Sunday to help us communicate information to the public. We did receive preliminary ash result testing on Friday night from the Kula area. The ash samples were collected on September 21st from 8 homes. And those homes ranged in age from about the 1930s to the 2000s. Those results did indicate exceedances of high levels of lead and cobalt and extremely high levels of arsenic. We believe these samples results may be generalizable to the materials that were burned in Lahaina. So we wanted to share this information as quickly as possible with the people of Lahaina. Once the EPA completes its phase 1 hazard removal, the DOH will be overseeing the collection of ash samples from Lahaina so we can know for sure what is there. The DOH and its partners have consistently been communicating the importance of protective measures regarding the ash, which is known to be hazardous. The presence of those substances is not surprising, but the concentrations are indeed high, which only reinforces the need to follow the precautionary measures that have been previously communicated. What we're going to do as a result, the arsenic, which is of the greatest concern, is 140 times above the environmental action level. And a lot of this guidance is geared toward that. It is a heavy metal. It is present in Hawaii. It is in volcanic soil. It's also present because of previous use of pesticides containing arsenic. But the levels that we're seeing as ash are likely due to its inclusion in the household construction materials that had been burned. So in response, for people to keep themselves safe, for people who are going in to the impacted zone and having direct exposure to the ash, that's the greatest risk. Ingestion of the ash would be the potential greatest exposure. So it is incredibly important that people continue to wear PPE that is properly worn and well-fitting to go into the impacted area. We're recommending that there be minimal disruption of the ash to the extent possible, particularly around the areas that border the areas immediately outside the impacted area where people may have returned. If any sifting is to occur, we just would really recommend that it be minimized, and we continue to work with the county on their re-entry process. We strongly recommend that pregnant women and children do not enter the impacted area. For those individuals residing just outside of the impacted area, we encourage them to be mindful of the risk that they have by ash escaping from the impacted area. We've put up air monitors that they can use to monitor the air. They can find that online at fire.airnow.gov. And there also are mobile applications that can be used that can also send alerts. So that would be helpful for them to be alerted so they can take the necessary precautions. Should there be ash in the air, that could indicate a potential risk of exposure to the toxic materials. And for example, should the air quality change to yellow, we would encourage people to go inside and close their doors and windows until it passes. We would expect that the disturbances would be temporary, and as the wind blows, it would be temporary and things would dissipate. So the exposure would likely be potentially intermittent. But there may be some accumulation. So cleaning surfaces on a daily basis as a matter of routine would be particularly recommended. And if there are young children who are going outside, to have caution about any ingestion of soil or debris that may be on the ground. We're working with the county and the EPA to facilitate, expedite, prioritize the application of soil tack along the impacted area that borders those areas where people have returned on the outside. Once that's applied, that will stabilize that ash and significantly reduce the risk of ash disturbance. Other things that people can do to protect themselves, again, as I mentioned, the surface cleaning, hand washing, and generally monitoring the air quality and taking those recommendations. So we will continue to work with our partners as we go through this, but we just wanted to be transparent with the public and get this information out as quickly as possible while we continue to work through this and identify next steps. Thank you.
Thank you, Dr. Fink. Next up, we have Superintendent Hayashi from the Department of Education.
Good afternoon, everyone. Thank you. The Department of Education continues to believe that reopening of our Lahaina schools for in-person learning is critical to the well-being of our students and to the Lahaina community. We've been reassured that our Lahaina campuses are safe for students and staff to be at, based on current air quality conditions and the extensive environmental testing we've done over the last several weeks. Since last week, we've been working closely with the Department of Health to update the DOE's health and safety guidance for our Lahaina schools, to take a more conservative approach whenever there's a change in air quality. We really appreciate the close partnership with Dr. Fink and the Department of Health as subject matter experts on public health. We've always operated as though the ash in Lahaina, where structures burn, were toxic. The Department of Health has consistently said that it would be a concern if that ash became airborne. Based on new DOH testing from the Kula fire, as Dr. Fink shared, we now have more information that confirms the concern about the ash and dust in the area where structures burn. We've been reassured that the likelihood that the conditions at schools will become harmful in the near future is very low. Still, we revised our guidelines, our safety guidelines, to be extra cautious if the air monitors pick up particles in the air, and will continue to work closely with DOH to regularly test and monitor conditions at our schools. We understand that DOH's announcement today is new information and it's complex information. While our plans to reopen Lahaina schools to students starting tomorrow remain unchanged, we understand families will need to take this new information, process what it means, and make decisions that are in the best interest for their situation and their ohana. Our schools will be flexible on student absences during this first week of reopening as families make decisions. Here's what the Department of Education has done to date to ensure our campuses are safe. Extensive environmental testing of soil and drinking water, which all came back safe. For soil, there was no visible ash at any of the schools, and the soil testing results indicate ash from the burn sites have not settled up at our schools. We've also gone through specialized professional cleaning at all of our interior, exterior spaces on our campuses. DOH and the EPA have installed air quality monitors outside all of our schools to detect fine particulate matter. The readings have been in the green or good level for the vast majority of time since installation weeks ago. Each school has a handheld monitor as well. We also have apps set to immediately notify our environmental services unit of any changes. We've installed a weather station at Lahaina Intermediate to track wind patterns and trends. We will be continuing bi-weekly white tests in classrooms to test for any particles settling on surfaces. We have safety guidance developed with DOH with a list of actions the schools will take whenever there are changes in air quality. We are updating our safety guidance again based on this latest information. The revisions would call for schools to consult with our environmental services unit when air quality moves into the yellow level, which is right after green or good. In the orange level, schools would close doors and windows, turn on our air filters, which are HEPA filters, turn off central air conditioners. Schools would also suspend outdoor activities at this level. Schools would also plan to transition to distance learning as a backup action when there are sustained levels of unhealthy air in the red level. At the purple level, schools would shelter in place if school is in session or close if not yet in session. Again, we strongly believe that reopening for in-person learning is important, and we're doing everything that we can do to make it as safe as possible and have put plans in place to take necessary actions if and when conditions change. Mahalo.
Thank you. Thank you, Superintendent. Okay, now we have time for Q&A. I ask that each media outlet, please state your name and which media outlet you're coming from, and please keep your questions succinct and brief. All right, I'm gonna start with Andrew Gomes. I see your video is already up. Do you have a question?
Sure, sure, thanks. For Dr. Fink, can you mention the number, the times over the action limit for the other two substances, cobalt and lead? And then can you tell us, like, for this most concerning arsenic level, how dangerous is that, and what can be, health effects maybe from all three also?
Okay. So I said the arsenic level was about 140 times above the environmental action level. Lead was a little over 3 times the environmental level, and cobalt was about 20 times above the environmental action level. All of these things at a high enough exposure, right, are potentially toxic. And we continue to work and to minimize exposure, and believe that with the precautions that we've been communicating, that people are able to really reduce their exposure and remain safe.
And then for that second part, can you touch on what, maybe if people don't do precautions, or, if they ingest some of these things, what can be kind of worst case scenarios or bad case scenarios?
So I think there's a range of what these substances can cause from a health perspective, based on the, again, amount of exposure and over the period of time. From what we've been seeing with the particulate level being a green monitor, indicating really no exceedance of ash in the air, the likely exposure to arsenic through the air has been very low. So that's been very reassuring. We communicate this information to reinforce that people continue to take the recommended precautions to ensure ongoing safety.
Thanks.
Thank you. All right, next question. We have Elizabeth Ufi. Can you please state which media outlet you're with and your question?
Hey, it's Nikki with KHON Channel 2. This is for Dr. Fink. So for the residents who are living next to the homes upcountry that have burned down, what impacts, if the wind blows, is this blowing into their home, or what are potential side effects from these people who have been living next door without the soil tax applied?
Great. So we have been, communicating that the ash is hazardous and people should avoid exposure to the ash. These results, again, just reaffirm that the ash is hazardous and the arsenic level is extremely high, which is concerning, and people should take the necessary measures to reduce their potential exposure to ash. For the duration that has occurred and the low of the air quality, the exposure to date, if at all, has likely been minimal to negligible. So we would not expect any health effects from any exposure that may have occurred to date.
Thank you.
Okay. Other questions? If none, all right. Does anyone else have any other questions? Sorry, Andrew, I see you waving. Are you waving?
Sure. I'll ask another one. Did I hear correctly that air monitoring stations have been installed in the neighboring residential areas in Lahaina next to some of the properties have burned? And is that, one on every block, or does everybody in a house who's living near or even next to a burned property have an air monitoring station?
So the number of air monitors can be seen on fire.airnow.gov. People could see the number of air monitors and their locations. We are working with the county to set up more air monitors. We think it's important to have air monitors really scattered throughout the perimeter of the impacted area. In addition, we will be planning to do additional air sampling so that we can really inform the public on kind of the risk of ongoing exposure.
Okay, Nikki, I see you have your hand up again.
Yes. Has there been any ash sampling so far for Lahaina?
There's not been ash sampling yet in Lahaina, waiting for the EPA to complete their phase 1 hazard removal so that folks can safely go in and collect ash sampling. In the absence of knowing what exactly is in there or what concentrations, really recommending almost what I would consider these universal precautions, that people should continue to assume that ash is very hazardous and to take the necessary precautions. And we are planning to go in as soon as possible to collect samples and do the testing of ash and lime.
And if I may, Dr. Fink, since you're clearly the expert here, how much, like 5 minutes looking at your burned home without any protection, or are we talking really long exposure to have any impact from these toxic chemicals?
So I'm still learning about this, and it's probably best to follow up later where we can get more input from toxicologists. So we just wanted to ensure that we were being transparent and getting this information out to the public and reinforcing the need for them to take their protective measures.
Thank you, Dr. Fink. Okay, lucky, I guess. Andrew, you have your hands up again. If anybody else has a question, please do raise your hand. We have a few more minutes left.
Okay, thanks. Last one for me, I think, or maybe one for each, Dr. Fink and Superintendent Hayashi. Who did the test? And then for Dr. Hayashi, I think you guys mentioned before that 300 indoor air filters were installed between the 3 schools. Is that, are those in place? Are they working? Are they expected to be more of a, I guess, a extra precaution?
I'll go ahead and take that one first. Okay, so we do have HEPA filters that have been units that have been placed in every classroom and in our offices. So in the event that we do need to utilize them, those filters filter air and particulates out within the classrooms.
And I think the second part of the question, Andrew, was who did the testing? That would be Dr. Fink. Just a second.
The sampling was collected by Department of Health employees. And there was a contractor who actually did the testing of the samples.
Thanks.
And I believe we are planning to post the results, and those results may indicate who actually did the testing.
Okay. Any additional questions? All right, if not, we will be in touch. I know this is, like we said, preliminary and unvalidated data, so there will be more to come. But we did want to thank you again to the media for helping us get the word out, and we will continue to be in touch.